More than 80% of adults over 60 will experience recurring back pain this year. But here's the part most people don't realize. In many cases, it isn't just aging. It's preventable mechanical stress, silent inflammation, and avoidable muscle decline, happening slowly, daily, often without you noticing. What most people over 60 don't realize is that small habits compound, and over time, they change how your spine absorbs force, how your nerves transmit signals, and how your muscles protect your joints. I'm Dr. Neurovia, and today we're going to walk through 7 common mistakes that quietly worsen back pain after 60, and more importantly, what spine specialists are now focusing on instead, because this changes everything after age 60. When pain flares up, the natural instinct is to stop moving, lie down, sit more, protect the back. But recent clinical findings suggest prolonged rest actually delays recovery and increases stiffness, particularly in adults over 60. Here's why. As we age, blood flow to spinal discs and surrounding muscles decreases. Intervertebral discs rely on movement to draw in nutrients. When you stop moving, circulation slows. Muscles begin to weaken. Joint lubrication decreases. Within days, muscle fibers, especially the deep stabilizing muscles like the multifidus, begin to atrophy. That means less support for your spine. And here's where it gets more serious. Reduced movement increases inflammatory signaling. That stiffness you feel in the morning? Often, it's low-grade inflammation combined with reduced synovial fluid circulation. But this is where most people go wrong. They think pain means damage. In many cases, pain means deconditioning. Solution? Gentle, frequent movement is medicine. 5 to 10-minute walks, 2 to 3 times per day. Light mobility exercises in the morning. Pelvic tilts and gentle spinal rotations. Chair-based core activation exercises. Movement restores circulation. It nourishes discs. It keeps nerve pathways calm. If pain radiates down the leg or causes numbness or weakness, that's when medical evaluation is necessary. But for mechanical stiffness, motion is protective. Here's what most people over 60 don't realize. You can lose up to 1% of muscle mass per year after midlife. This process, sarcopenia, directly affects the spine. Your core is not just your abdominal muscles. It includes the transverse abdominis, diaphragm, pelvic floor, and deep spinal stabilizers. When these weaken, spinal load shifts to joints and discs. That increases compression, and compression irritates nerve roots. If you ignore this, here's what happens. Small structural stresses become chronic inflammation. Pain becomes persistent. Here's what spine specialists are now focusing on. Low-load, controlled core retraining, not aggressive sit-ups. Instead, supine abdominal bracing, bird dog variations, modified side planks, resistance band rows. Strength improves spinal stability. Stability reduces nerve irritation. Reduced irritation lowers pain signaling. And there's another layer. Muscle tissue improves insulin sensitivity and reduces systemic inflammation, both critical after 60. Strength is not about aesthetics. It's metabolic protection for your spine. Sitting itself is not the enemy. Uninterrupted sitting is. When you sit for prolonged periods, hip flexors tighten, gluteal muscles deactivate, lumbar discs experience sustained pressure. Blood flow through the pelvis decreases. Over time, this alters spinal curvature. The lower back flattens or overcompensates. Nerves exiting the lumbar spine become more susceptible to compression. But here's where it becomes more serious. Reduced circulation from prolonged sitting also affects pelvic blood flow, which influences hormonal balance and tissue repair. After 60, recovery capacity is already slower. Reduced circulation compounds that delay. Solution? The 30-30 rule. Every 30 minutes, stand for 30 to 60 seconds. Add gentle back extensions, shoulder rolls, marching in place. Consider a supportive chair that maintains lumbar curvature. And strengthen your glutes. Strong gluteal muscles reduce lumbar strain by distributing load through the hips. This is mechanical redistribution, and it changes everything after age 60. Back pain is not always structural. Sometimes it's biochemical. Chronic, low-grade inflammation increases pain sensitivity. It affects how nerves interpret signals. It slows tissue repair. Recent clinical findings suggest inflammatory markers like C-reactive protein correlate with musculoskeletal discomfort in older adults. But this is where most people go wrong. They focus only on stretching, not internal inflammation. After 60, inflammatory load can increase due to processed foods, high sugar intake, poor sleep, chronic stress, hormonal changes. Solution: support anti-inflammatory pathways. Nutrition strategies: omega-3 fatty acids, fatty fish, flaxseed, colorful vegetables rich in polyphenols, adequate protein to preserve muscle mass, hydration for disc elasticity. Sleep is equally critical. Deep sleep supports growth hormone release, which assists tissue repair. And if morning stiffness lasts more than an hour, or if pain is symmetrical and persistent, consult your physician to rule out inflammatory arthritis. Inflammation is not weakness, it is a signal, and signals can be addressed. Many adults over 60 fear that lifting weights will damage their back, but carefully supervised resistance training is one of the most protective interventions available. Here's what spine specialists are now focusing on: load tolerance. When bone is exposed to appropriate resistance, it stimulates remodeling. This protects against osteopenia and osteoporosis. When muscle is challenged, it strengthens tendon attachments, improving joint stability. Without load, tissues weaken. If you ignore this, here's what happens. Even minor daily tasks, carrying groceries, gardening, feel stressful to the spine. Start with bodyweight squats to a chair, light dumbbell deadlift patterns, resistance band rows, wall push-ups. 2 to 3 sessions per week, controlled movement, slow tempo, proper form. If you have known spinal stenosis, compression fractures, or severe osteoporosis, consult your healthcare provider before initiating resistance training. But do not underestimate your capacity. The body adapts at every age. Posture is not about standing rigidly straight. It's about balanced load distribution. After 60, vertebral discs thin slightly. Muscle tone changes. Vision shifts, which affects head positioning. Forward head posture increases strain on cervical and thoracic structures. That tension travels downward into the lumbar spine. But here's where most people go wrong. They try to fix posture by forcing shoulders back, creating tension. Instead, focus on alignment cues. Crown of head gently upward. Rib cage stacked over pelvis. Chin slightly tucked. Weight evenly distributed through both feet. Strengthen mid-back muscles to support this alignment. Better alignment improves nerve space, circulation, and breathing efficiency. And breathing matters. The diaphragm is part of your core. Shallow breathing reduces spinal stabilization and increases tension. Slow nasal breathing with full rib expansion enhances parasympathetic tone, calming pain pathways. Not all back pain is benign. If you experience progressive weakness, loss of bowel or bladder control, unexplained weight loss, night pain that doesn't improve with position change, seek medical attention promptly. But here's the important distinction. Most back pain over 60 is mechanical and manageable. What most people over 60 don't realize is that imaging often shows degenerative changes, even in people without pain. Structure does not always equal suffering. The focus is function, mobility, strength, circulation, recovery. When pain persists beyond 6 weeks despite lifestyle adjustments, a structured evaluation with a spine specialist or physical therapist can provide targeted intervention. Early action prevents chronic cycles. Back pain after 60 is not a personal failure. It is a signal from a system that needs recalibration. Small daily decisions, movement, strength, nutrition, posture, circulation, compound in your favor just as easily as they compound against you. This changes everything after age 60. You are not fragile. You are adaptable. With the right inputs, your spine can remain strong, mobile, and resilient for decades. I'm Dr. Neurovia. If you value clear, evidence-based health insights designed specifically for adults over 60, consider subscribing. because informed action is one of the most powerful forms of prevention, and your next decade can feel stronger than the last.